So welcome to the Healthcare Professionals panel here at COD. It's something that we've been doing as a 3 different clubs involved for the past few years. It's been pretty good success, and a lot of students have got a lot out of it. It's a great opportunity for students and really anybody interested in the area to come in and really get a feel for what it's like to be a medical professional in today's industry. And we tell them straight up, don't sugarcoat it. You know, if you don't like your job, tell them you don't like your job. If you love it, tell them you love it and tell them why. Because that's important to all of us as students and all of us looking for a new career. So it's very important. So welcome to the panel discussion. Before I introduce the panelists, I'm going to introduce a few people from the clubs involved in this. First of all, the Pre-Pharmacy Assistant Club. I'd like to introduce Andrea Gaba and have her give a few words on what their club does and what it entails.
We're all about educating future PAs, finding out what roads they're taking to get accepted into schools. I think we all benefit from hearing other people's stories, learning what we should be doing and what we should be doing differently. So I've learned a lot about, volunteer opportunities, what kind of classes I should take. We had a girl come in who got accepted into PA school already, so she got to share a little bit about her journey to being accepted. I think she got into Rosalind Franklin. Anyone who's interested, we meet every other Friday, so look us up. We're online. Anyone who may be interested in becoming a PA.
All right, thank you, Andrea. And now, Future Pharmacists Organization. This is Agnes Shigawa.
Hi, everyone. My name is Agnes. I'm the co-president for the Future Pharmacists Club here in COD. Basically, what we do is we come together, students, the future pharmacists come together, and the main purpose is to enhance our academic life. We come together, organize group studies for students who have some challenging areas and some courses. We organize field trips. We go out, like upcoming very soon, we'll be having a blood donation at the Red Cross Society, but we don't know the dates yet. We are now still organizing. Once in a while, we have recruiters who come from pharmacy colleges who come together and advise us on what to do, what to expect when we go to the colleges. And basically, that's it. It's about, academic life. It's not all that. We have social life, too. We come together, network, socialize, bring some stuff together, eat, and talk about school life. Yeah, and we have a great advisor, Professor Mary Newberg. She's not here today. She's our pre-pharm advisor who encourages us a lot and tells us our challenges and stuff we expect in the future. Our meeting days are every other Friday at HSC Building 3314 at 11 a.m. And sometimes, too, we meet online group discussion. So basically, that's what we do. Thank you.
All right, thank you, Agnes. And I'm Scott Walters. I'm the president of the Chemistry Bonding Club here at COD. We have many a professor that supports us. In the back, Professor Libna Hawk, Professor Roby, Professor Troutman also is an advisor, as well as Professor Pesey. So we're blessed to have all of them support us. In the Chemistry Bonding Club, we try to provide a meaningful symbol for which our students can kind of adhere to and be more of a part of the school. Through that, we provide an opportunity for our students to broaden not only their academic horizons, but personal horizons in terms of meeting people and getting out there and seeing what people have that they can learn from. That's a big importance to us. Me myself, I'm back in school after 10 years in the business community. Can provide a lot of insight to students that are just on their first go around here. So hopefully put them on the right track first and foremost. Moving forward, I'm going to introduce our panelists. I'm going to go down the line, introduce them real quickly, and then I'm going to turn it over to them. We'll start with Kelly Bramlett. She is a physician's assistant with Midwest ENT Consultants. Ian McVicker here is a second, and it's a pharmacy technician and is currently working on his MBA and MPH. Further down the line here, Allison Manigan is a physician's assistant of dermatology and is a physician assistant at DuPage Medical Group in Wheaton. Down the line a little bit further here, Professor Barb Cesar is the associate professor of dental hygiene here at COD. And a little bit further, Professor Charlie Vanderwerf is a professor at COD here of respiratory care. In a little bit here, we should see Professor Dillis Galliot, who is a professor of nursing. She has some class obligations, but should be here shortly. So if I could turn it over to Kelly here, if you could just kind of introduce yourself, what you do, what you love about your job, what you hate about your job, and any brief insight you might give to students looking to go down a medical professional path.
Okay. Well, hello, everyone. As he said, I work as a PA clinically. I went to University of Illinois undergraduate. I got a degree in biology and Spanish. Then I went to Midwestern University, which some of you may be familiar with, right here in Downers Grove. And I graduated from the PA program there in 2007. And since then, I've been working for the same place, private, independent ear, nose, and throat clinic. And I love it. For the most part, I really have been very happy with my choice. I kind of struggled with whether or not I should go to medical school or pharmacy school or something else in the healthcare field, probably like a lot of you guys. But I did end up with PA. And since then, I have felt like I've just been, every year I've been doing this, I've been more and more satisfied with my choice. A typical day for me, usually, it varies, is about 9 to 5. Some days I'm in much earlier if I'm seeing patients in the hospital. Some days I'm there much later if surgery goes late. For the most part, I am working with patients in a clinic. I'm seeing my own patients, we examine and prescribe. But a lot of times I'm also in surgery as well, so I divide my time. Not all PAs work in surgery. It's a decision you can make. As a PA, you do have a supervising physician. So you are very independent. You'll do things pretty much on your own all day long, but at the end of the day, your sort of boss is your supervising physician, and you may have more than one, as I do, since I work for a group. And that can be challenging sometimes. But I think for any of you that are considering the PA profession, you need to be really good communicators. You're kind of the glue that holds everything together. You'll be talking with your patients' families, with your supervising docs, with other physicians, nurses, lab personnel, everybody, trying to make sure that your patients get what they need. And I'd also say, as far as getting into PA school, challenge yourself with your classes, because PA school is difficult. It's quick, relatively. It's only a couple of years, but it's intense, and you just want to be ready for it. So that's what I say. Good luck.
All right, thank you very much. We'll move on to Ian McVicker.
Hi guys, my name is Ian McVicker. I'm currently a certified pharmacy technician at Walmart. I've been there for 3 years, and I gotta tell you, it's a unique job. It's a very high stressful job. If you want the job, you actually want to be there. You want to help the people. You want to help them get their medication. You do get yelled at a lot, like every day, all day long. And you think it's a joke, but it's not. You get yelled at from the nurses. You get yelled at from the doctors, the patients. But it is a fulfilling job because you are helping them. To succeed in the job, you have to be a good communicator. You have to communicate with the patients. You got to communicate with the doctor's office. You have to know how to communicate with the insurance companies, figure out what medications are covered. If something's too expensive, you have to work to get it cheaper. You got to see what's on their formulary, contact the doctor. And talking to all those companies, you really see like how their operations work. So you get a sense of how the insurance companies work if you're interested in move into it being insurance. Or if you want to work in a doctor's office, you see like the line of order there, how it has to go from the nurse to the doctor, back to the nurse, back to you. And these things take time, and that's why we get yelled at, because they think it's instant. You also get a sense of how the pharmacy works, and that's why I'm no longer going to be a pharmacist. So I turned my gear into being eventually want to be a healthcare consultant. So I'm getting my MBA and my MPH, Master of Public Health and Master of Business Administration. I feel like that way I could make a difference to people's lives without interacting with them. Okay. So that's the path I took, and it's good so far. I'm currently looking for an internship to do that, but I do have half a semester left before I get my health science degree from Benedictine University, and then I'll go to the dual master's programship over there. Thanks.
All right, thank you. Move on to Allison Monaghan.
All right, I'm Allison Monaghan. I work at DuPage Medical Group. I've been there for 12 years, actually yesterday. I went to undergraduate at Brigham Young University in Utah, and then I went to PA school at Baylor College of Medicine, so I don't really know any of the schools up here, except that I've worked with a lot of the students who have come through our office. My path to being a PA was a little convoluted. I thought I was going to be a physician my whole life. I was going to be a physician, and I got to be a senior in college, and I had taken the MCAT, and I could go to medical school, and all of a sudden, wow, that really was not what I wanted to do, and I was lost. It was 19 years ago that I graduated from college, and I said, what do I want to do if I don't want to be a physician? And I had never heard of a physician assistant. No one around me was a physician assistant. There were not very many physician assistants in Utah. And so I just said, I've got to take a step back. I've got to figure out what I want to do. And I tried to find a job in pediatrics just as a medical assistant. No one would hire me because I wasn't a certified medical assistant, even though I was a college graduate. And so I found someone who was willing to train me in dermatology, and so I got a few years under my belt as just a medical assistant in dermatology, and I thought, okay, medicine is good. I still want to be in medicine. I just don't want to go to medical school. And there was a physician assistant in the practice, and I followed him around a lot, and I saw that he did everything that the physician did in our practice. Dermatology is very broad. There's a lot of cosmetic stuff, there's surgery, there's medical dermatology, and it just depends on what you want to do. But the nice thing about being a physician assistant is that you can do what your physician delegates for you to do. So if your physician is able to do something by law and they say you can do it, you can do it. So Kelly does surgery. I don't do surgery, but a lot of the PAs in our practice do surgery. I think that being a PA is the greatest thing in the world. So anyway, when I decided that, okay, being a dermatology PA is great, this is what I want to do, I applied and I didn't get in. So my biggest thing for telling people who want to be PAs is don't give up. Most of the PAs that I work with actually got into PA school their second year. It's hard. It's hard to get in, but if you want to be a physician assistant, just keep pushing forward. You can do it. They'll let you in eventually. Not just anyone, but if you really have the desire, don't give up just because you were rejected once or even twice. It'll happen for you. So I'll leave the rest for questions later.
Fantastic, thank you. We'll move on to one of our very own professors here, Professor Barb Szor.
Hi. Well, I have been I've been a professor here at associate professor here at College of DuPage for 10 years, but additionally, I've been a practicing dental hygienist for 35 years. I had a sort of easy road in the sense that I knew that I wanted to help people. I knew I loved science, and I knew I didn't want to have to deal with the harder issues of very, very ill patients. So I thought about it, and I applied to dental hygiene school at Loyola University, so I received my undergraduate degree there. And then I knew, because I love my profession so much, that I always kind of wanted to teach. And I hope I bring to my students the energy and the love I have for my profession. So basically, why do I love dental hygiene? Dental hygiene is a great field in which you not only use your hands, which everybody knows when they go to get their teeth cleaned, oh, there's a hygienist, cleaning their teeth. But in addition, you use your mind. You're dealing with patients. You're helping prevent disease. You're motivating patients. In fact, it's funny because it seems like we've incorporated in our program all along a broad spectrum of all the sciences, social as well as behavioral and medical sciences. The mouth is the mirror to the body. There's a lot of manifestations of systemic diseases. In fact, I was just preparing a lecture about blood disorders, and it's amazing how much you can find in the mouth, as well as through a thorough medical history with your patients. You have a one-on-one relationship with your patients, although in the state of Illinois here, we can work independent of a dentist on site as long as the dentists are the ones that own the practice. They are the ones that have to examine a patient once a year and prescribe basically our treatment. We are pretty autonomous. The dentists rely on us quite a bit to dot the I's and cross the T's as far as when it comes to medical issues that could be contraindicated, or sometimes we've seen some interesting things so far as taking a dental x-ray and finding a calcified carotid artery. So it's really amazing, and people don't often stop to think how much the mouth and the amount of testing we do on patients and helping with patients, the things that we can find out about them systemically also. And like I said, about 10 years ago, I began teaching here, and I really like it. I hope I bring my enthusiasm to my students, as I said. And I still work every other Saturday in private practice, so it seems to be the career that was right for me. The type of person that should go into this program, though, whether it was at a four-year school or at community college, is a student that's going to definitely commit themselves to studying for 2.5 years. Dental hygiene program is a very competitive program. It's a cadre of students that move through the program. The classes are already assigned as far as when they are going to be taught by who's going to teach them. So unlike a lot with undergraduate work, you can pick and choose your classes. In a dental hygiene program, as I said, whether it's here or at a university level, it's already set up for you. But the nice thing about the job itself, in addition to just helping people, is there's a lot of flexibility. For example, as I said, I work every other Saturday in private practice. You can work once a month, you can work 5 days a week, you can work 6 days a week. And that is, and there's a lot coming down the pipeline as far as adding to our education and making us comparable to the physician's assistant as far as dental therapists. So it's still very exciting, lots of good stuff going on, and it's one of the things that I love.
All right, thank you very much. We'll move on to Professor Charlie Vanderwerf, who is a professor here at College of DuPage and is a specialist in respiratory.
Thanks. So I got started in respiratory care by accident. Foolishly, I quit my job in my senior year of college and then realized I didn't have enough money to finish paying for it. So I had to get another job, and I found out that if you worked for Loyola University, which is where I was going, you got free tuition. So I looked and found any job I could get at the medical center, which happened to be cleaning surgical equipment and respiratory care equipment. So while I was doing that, the respiratory people said, hey, do you want to come work for us? And stocking equipment. And I was like, sure, does it pay more? And it was like at 25 cents more an hour, so I took the job. And then I found out that they had all this really cool equipment and were involved in every type of patient that you could work with, from premature babies up to elderly patients. We work everywhere in the hospital, the emergency room, the operating room, every intensive care unit. And actually, once they found out that I had a bachelor's degree in biology, they're like, oh, you can do treatments. So I did that for about a year, and they're like, you should probably go to school. And back then, so this is 1980, you could, if you had a bachelor's degree already, you could go to respiratory care school for 5 weeks and get credentialed. If you already had a year of experience. You can't do that anymore, sorry. You have to go through a whole 2-year program. So what I really like about being a respiratory care practitioner, and I did that from 1980 until 2004. So I stayed because I really liked it, even though I got into it by accident. Kind of what I like is, I wanted to be a physician, but if you work night shift, your grade point average doesn't really get you into medical school. So I was looking for something to do, and I found respiratory care, and you're involved in the whole healthcare team as a respiratory therapist. You're working with the physicians and nurses and PT and OT and the nutrition folks. So you're very involved in all of that, depending on where you work. And we have the best toys in respiratory care. So mechanical ventilators, just Google lung flute if you have the time. That we don't actually use those, but it's the things people will invent and try and get you to buy. It's pretty interesting. So who would do well? If you're kind of a nerdy science or geeky science person, that helps. You have to like working with sick people. They're not always happy. You just kind of have to, deal with that. When you're sick, you just get kind of crabby. But that's okay. You get thicker skin once you practice for a while. And you have to not mind working off hours. Once you're in healthcare, it's a 24/7 job when you're working in the hospital. And most of us work in hospitals, but you can work in home care, the private sector, and some folks work their way up through the food chain in the hospital as an administrator. So you can do that. And did I mention you have to work weekends, holidays, and night shifts sometimes? So that's kind of that, you just have to be very flexible in your hours because it is a 24/7 situation. So I'll stop there.
All right, well, fantastic. Thank you guys so very much for your introductions. Now that you have done so, I'm sure you've opened the floodgates to a whole bunch of questions that we're going to prod and pry you with now. So what we'd like to do is kind of open the floor to you guys who are interested in becoming medical professionals as to, what it is that you might value from asking our panelists. So who out there has a question for them? Just going to run over a microphone for you.
My question's for Ian. I think your testimony definitely begged the question, what made you decide to not be a pharmacist?
Okay, so there's a lot of stress. There's a lot of school, and I was going for pre-pharmacy, but then just because of the competition of it and the fact that I was working full time and I was in school full time, it's like I didn't want to stress myself too much when I found a path that you can make the same amount of money, if not more, with less school.
I definitely understand that then.
But I switched my path because pharmacy is a high competition, and the school is a lot of money. That's what I meant to say, people. The school is a lot of money, and I feel like this way it's a better path for me personally.
Okay, and then just one follow-up question. How is working as a pharmacy tech as like a component to school, like a way to make an income while you go to school? Is it flexible or?
For me, it's flexible. I get to work my schedule around my school schedule. So if I take a night class, I could work in the morning, or if I work in the morning, I could work at night. I can't speak for hospital, but I know a lot of retails do that because they know that the pharmacy techs, they're like younger adults, so they're in school, so it's a lot of flexibility.
Thank you.
Yep.
All right, thank you. We'll go back here because you're closest. Looks like we're going to switch out the microphone real quick. Oh, there you go.
Good evening. My question is to Callie and Barb. I heard you say what you do and that you enjoy what you do, but Is there a way you can probably tell in more detail what your job consists of you doing?
Sure. Well, my job has actually changed every year that I've been practicing because the more that I am around and the more that I am doing and the more that my supervising physicians have trust in me and I have confidence in myself, the more I do. But for the most part, as a PA, regardless of whether you work for a private practice or for a hospital, you're going to be seeing patients just like a doctor does. You're going to have a schedule every morning of people that you're going to see. You'll get X amount of minutes per patient to see them in. Part of the reason one of the many reasons I like being a PA is I get twice as long as the doctors do to see a patient. And I think a lot of patients like that. They have more time to talk to you. We have more time to form an assessment. Basically, they come in, they say what's wrong with them. We take a history, write down what's wrong. We do a physical exam. We review any blood work or imaging or testing that they might have had, come up with a diagnosis, and then decide how we want to treat them. And this is all happening, kind of quickly. Ultimately, if they need to be prescribed a medication, PAs in all states have prescribing rights. So you can prescribe medication. If you need to order a test, a lab test, some kind of diagnostic imaging, whatever it may be, if you need to refer them to another specialist for further evaluation, you give them all of that information, and then they leave. I would say probably for me personally, most days of the week, I am seeing patients like that in an outpatient setting, probably 75 to 80% of the day. The rest of the time, I am reviewing results from my patients on tests that I've ordered. I get those results back. I need to look at them and decide what I want to do, if that patient needs to come in for another appointment, if they need to have something else done. And also my supervising physician, any patients that he sees, all the tests that he orders, I also get all of those results. So I review them and decide what needs to be done. Sometimes I'm on the phone, I'm calling patients back and telling them all what they need to do. Sometimes I'm trying to get a hold of insurance companies to get medications authorized. That is bane of my existence. Sometimes I am just trying to make sure things are flowing at our office. So, there's a squabble over here between the nursing staff or the receptionist and so are having a bad day. So I'm kind of managing a lot of people at the office. I didn't start out doing that, but I do that now. Another part of it for me, again, personally, about a day and a half out of every week I'm in surgery. If you are a PA in surgery, which is a very common place for PAs more and more, you will be working with a physician. You'll never be operating alone. And the physician and you will stand on opposite sides of the patient, more or less, and you can do all kinds of things. So you can cut, you can suture, you can sew, you can use different tools and instruments, you can close up wounds. Some PAs are very involved in the care prior to surgery. Some PAs are very involved in the care after surgery. For me personally, I don't do a whole lot prior to surgery, but then the day I'm in surgery, which, the hours vary because it depends how many people are having surgery that day. Like this morning, I started at 7 o'clock because our first patient was in the operating room ready to go at 7 o'clock. So I needed to be there before 7 o'clock, so it was an early morning. But I finished by about 1:30, and I'm done for the day until here. Other days, it's much earlier and much later, but yeah, that's, for the most part, that's what I'm doing.
Does your day consist of
Okay.
a little different?
Oh, it's quite different than that. Basically depends on the amount of hours you choose to work in a particular office. It can be it can be 4 hours, it can be 8 hours, it can be 10 hours. Basically, a patient would come in, and normally the dental hygienist sees a lot of new patients. So you are kind of doing your PR for your dental office too. You're kind of setting the scene of the values in the dental office. We take thorough medical histories and assess those to make sure the patient's okay to be treated. Then we normally expose radiographs, x-rays, process them. Nowadays we have digital, so we don't have to do a lot of processing like we used to have to do in the old days. Then we do oral cancer exams, and then we do dental hygiene diagnosis. And basically what that is we evaluate the teeth and the supporting structures of the teeth as far as periodontal disease. We also have a nutritional component where we ask our patients, what kinds of foods they're eating, as far as for not only dental health but general health. So like I said, it really encompasses a lot of the sciences that you would not necessarily think that you'd need, because we basically treat a patient as a whole patient. So we're not just looking at their mouth or this tooth or, when we actually treat, we use hand instruments as well as ultrasonic instruments, and that might be the only drawback. But if you are in any type of medical field where you're going to be involved with bodily fluids, obviously you have to have that wish to not mind saliva and blood and multiple other things that could be existing in the mouth at that time. In addition to is instructing patients on how you're partnering with them to help them take care of their mouths.
Thank you. Allison, is your day pretty much the same as Kelly's day?
I would say it's not much different than her clinical days, but all of my days are just clinical days. I have my own patients. My physician has his own patients. So I have a schedule for the day. I come in, I see it. If there's a patient that really throws me for a loop, then my physician is almost always there. If not, there are some other physicians. And if he's not there at all, then I make do, and I usually make the patient come back another day. But usually I see them, I assess them, I treat them, I do biopsies, I order labs, I review labs that they come in with. And the things that I do vary from just very easy, quick little wart treatments to, diagnosing this horrific rash that they've had for years and no one can figure it out. I love what I do because I see infants and I see 100-year-old patients and 105-year-old patients the way that people are living these days. So it's a nice field in that you can do anything. And as a PA, you get out of school and you have a very broad medical education. You don't specialize in anything in school. You have your standard rotations, and then you have probably 2, maybe 3 electives, which maybe you can do something that you're particularly interested in. But when you get out of school, you really can do anything. So you can try a job, and if you hate it after a year, you can try another field of medicine. And if you hate it, you have the ability to go from one to another. A lot is on-the-job training. Physicians usually recognize that and are willing to train you. A lot of times physicians want new graduates because they want to train you their way. So it doesn't matter that you've not necessarily had experience in a certain field. But my days are nice. As a dermatology PA, to have very little call, so that's really nice. I go to the office. I'm usually there around 9:30, and I leave at 5. So for me, it's really good.
Thank you.
All right, thank you very much. We've got a question in the back, I believe. What's next? If you don't mind, black shirt.
Hello. This question is for Allison and Kelly. I was just wondering, as physician assistants, do you have opportunities to travel like internationally, maybe for like volunteer opportunities?
I'll
stuff
start
like
with
that.
it. I haven't, but a lot of the PAs in our office have. One of our PAs traveled to Africa with a group. It was actually set up by a drug company and paid for mostly by the drug company. And then my physician that I work for now, with the Catholic Archdiocese, they have something called Solidarity Bridge where they go to Bolivia every year. So my physician goes every year, and a couple of the PAs have gone on that. So there is opportunity to go. I have a family at home, I have young kids. I choose not to go, but it's something that I foresee myself doing in the future.
I would say the same. I did take one trip. I got a Spanish degree, so I ended up seeing basically all of our Spanish-speaking patients. But I thought I would maybe use my language elsewhere. So I did take a trip down to the Dominican Republic, and then we went to Cuba, and we treated patients down there. Both times it was organized through a church, and it was a group of healthcare professionals, several PAs, lots of physicians and nurses and otherwise. But in ENT, it is considered a surgical specialty. So like Allison, we see little itty bitty babies all the way up to the oldest of the elderly, men and women. And there are a lot of procedures. So as a PA, during the day, I do a lot of procedures in the clinic as opposed to just in the operating room. But there is a lot of need elsewhere to sort of, do some of these sorts of small procedures with very rudimentary equipment in other places. And I would encourage any of you who can get out to do that to take that opportunity. It was well worth it.
Thank you.
I don't think you have to wait until you graduate either. I went on a dental mission. I am certainly not a dental person whatsoever, but I functioned as a somewhat dental assistant, very rudimentary. But, we went to Peru, and these kids had teeth falling out all over the place, so I assessed them. And, you don't necessarily have to be a graduate to do something like that and to be effective.
All right, thank you guys. We'll get another question over here.
Okay, I don't know anything about the PA program, and honestly, I wanted to be a surgical nurse, and then you said cut, and I'm excited. So, if you wanted to do something like be a PA, how many years of school is it? Can you hear me? Mm-hmm. And if you want to operate or assist in operating, is it more school? Can you specialize? How do you cut?
Yeah, so for PA school, it's kind of like medical school where there's a set of prerequisite classes that you have to take, and most of them do overlap with pre-med. So a lot of core science classes and things, but there are some variations among the schools. Some PA schools require, biochemistry, and some of them don't, things like that. So you have to look school to school. But once you satisfy that requirement for those prerequisites, you can get your degree in anything. I mean, I was in PA school with people who had, music degrees, whatever, and they just happened to take all those extra science classes. So most people end up with a science degree because you have to take all those classes anyway. Once you're in PA school, like Allison was saying, you're basically trained to be an internist or like a family practitioner. So you see kind of just general medicine. Once you're out of PA school, it depends sort of on what you want to do and what you get a job in as far as what you will actually do, what area of medicine you're in. So for me personally, I had an elective as part of PA school in ear, nose, and throat, and I liked it because you see all ages, and a lot of it was kind of already things that I was comfortable with, family practice like sore throat and headache and ear infection and things like that. And then you got all these specialized things, all these weird syndromes and disorders I'd never really heard of and I didn't know about in PA school. And so once I got hired, my supervising physician basically led me through that. I followed him around like you do as a student, and then I started to gain knowledge and such and went from there. If you want to be a surgery PA, you can be strictly a surgical PA where all you do every single day is assistant surgery. Or you can do what I do, which is see patients most of the time in clinic, and then some days I do surgery and assist. you will have to do a surgery rotation as part of school. So everybody that graduates from PA school has some basic surgery skills. Some people hate it and they don't ever want to do anything like that. Some people love it and that's all they want to do. I guess I fell somewhere in the middle. So after I'd been working just clinic all the time for a while, I thought, you know, what would be great to not have to talk to every one of my patients. So when they are asleep, it's nice. You can just talk to your supervising doc. And I didn't, I mean, I knew some basic things, but I certainly wasn't doing everything at the beginning that I was now. It was training on the job. This is how you do it. This is what you know, this is the kind of suture. This is the kind of needle. This is how much pressure you apply. Don't do this, do that, and you learn. So yeah, anybody who goes to PA school can go into surgery if they want to.
There are some surgical residencies for PAs.
Yes, there are
PAs
now.
can do residencies. It's not the same as the MD residencies or the DO residencies, a PA residency, and there's a dermatology residency, but there is a surgical residency or multiple surgical residencies. I graduated 12 years ago, so it's a long time ago, but I know Yale had one. There are special tests for board certifications. Every PA has to take the same certification nationally, but then you can subspecialize even on your tests, and you can say, I am specialized as a surgical physician assistant. So if that's what you want to do, it is definitely out there that is, you can make that your pigeonhole.
Yes, and
And then I think you can, if you get into it and you say, oh, it's really not what I want to do, then you can pull back and you can do ENT or you could do dermatology and you can do a little bit of surgery, and I do surgery all the time, but you can certainly start out as saying, that's what I want to do, and it's what I want to do all the time.
Part of the beauty of it is being so flexible, because I know plenty of PAs who work 2 part-time jobs. They work in women's health part of the time, and they work in the ER on the weekends, or any mix of any kinds of medicine you can do if you want. So some people who aren't sold on just hanging out with snotty kids in pediatrics every day, want to have some adult conversation, so then they go and spend the other time in cardiology. And it seems like maybe that doesn't, that wouldn't make a whole lot of sense, but you can sort of make it work for you if you want to.
Thank you.
She's excited.
Hi, I'm in the process of getting ready to apply to PA school, and I know they require patient contact hours, and I know a lot of the requirements have changed over the years, so I don't know if you can answer. I'm asking for both Kelly and Allison's response, but what did you do as patient contact hours before applying? That's my first question, and my second question would be if you had to shadow a PA before applying to PA school, because that's becoming one of the requirements as well.
I don't think I had to do those. I worked as a medical assistant for 3 years beforehand. I think a lot of the PAs who have either worked in our office or rotated through our office as students have done CNA programs. Some have been phlebotomists, different things like that. But you can call a PA, your friendly local PA. We're 2 of them, but there's a lot of PAs out here and shadow. So it just depends on how much shadowing time you need. But we have a lot of students who will come in and spend some time.
And then
call them up.
Do you think they would be willing to?
Most of us are.
Yeah,
Yeah.
we all had to do the same thing, so we know that it stinks.
Yeah,
but-
so I'd start with your own doctor, and if your doctor has a PA, say I'm a patient in that practice. But if not, then start looking in the phone book. Go to Midwestern and ask if they have PAs that they send their students to, because we have students rotate through our office. Midwestern has 2 months of the summer where students will come and spend time with us. So they're going to have a list of local physician assistants, and you can just ask them if they can give you a list of the PAs. And
This
they'll
is
do that.
Midwestern University?
Midwestern University in Downers
Downers
Grove.
Grove.
Yeah. So you don't have to be applying there. I would just call their office and just say, do you have a list of PAs in Wheaton or in Glen Ellen that maybe I could call up?
I would definitely recommend, even just the cold call. I mean, I had 2 students in the last 2 weeks who both found me online, or one of them found out from a friend of a friend whose mom is a patient at the practice or some ridiculous thing, and just left me a voicemail and said, hey, I'm a college graduate. I'm not sure what I want to do. I have some interest in PA school. I was wondering if there's any way possible I could just come in for an afternoon and shadow you. I was like, sure, come on in. So
We work with people, we like people, so
Yeah.
most of us are gonna say, yes, absolutely come, so
mean,
don't be
there-
afraid.
There was a time, we recently hired 3 new physicians. So there were a lot of changes in our office, and so for a good several months, we just weren't having any extra students come by. I mean, there'll be things like that that are sort of out of your control, but I would say do that. I did shadow PA, only a handful of times, maybe 5 times. I don't think it was a requirement then, even back in 2005, but it was encouraged.
And what did you do as patient contact hours?
When I was down at University of Illinois, there's a hospital there, Carl
went there
Hospital. So I was working as I forget what they call it, like a nursing secretary. It's like the nurse on a hospital floor unit. I had no idea what I was doing for a long time. But it was a good experience. It was a good experience. And then I also did the CNA thing. I went through the class, but I never actually worked as one. So.
They took the nursing secretary as patient contact hours.
They did, yeah, because we
now
would.
They're getting very, very.
I know, that's what I've heard.
Yeah.
Back then, you could, anytime there's a new admission into the hospital floor, as long as you went into the room and you took their vital signs, that was considered patient contact. And if that didn't count, I wouldn't have really had much. Yeah, so they're getting tricky.
This is to Kelly and Allison. What made you choose your specialties?
You want to start?
You go ahead.
Okay. I stumbled into it. I really wanted to do pediatrics. I thought I was going to do pediatrics forever. And when a pediatrician wouldn't hire me because I was not a certified medical assistant, there was an ad in the newspaper for dermatology, and my mom said, "You're a college graduate, you need a job." And I said, "I can't think of anything worse than dermatology. That sounds gross and disgusting, and just like saliva, it would be like, warts and pus and fungus, and how horrible would that be?" But I went to the interview, and I loved the woman, and she said she trained me, and I just fell in love with it. It didn't take long at all. I was hooked. So.
Yeah, in a similar way, I kind of stumbled into it too. I had an ENT elective rotation as part of PA school, which the only reason I took it is because it was very close to my parents. So I was going to have about a 1.5-minute commute. Really, that was the only reason. And I don't know if I fell in love with ENT or I fell in love with the people I was working with. I guess initially it was probably more the people I was working with at the practice. And then it became more evident that I like I mentioned before, there's a lot of family practice and then a lot of kind of specialty things too. And there's a lot of procedures as well. So it was just a good mix of everything. Yeah.
On a different note, Charles, could you describe a typical day of a respiratory therapist?
Funny you should ask. So it all depends on where you work. Most of us work in hospitals. So if you're working in a hospital, your day might include activities like oxygen therapy. I'm going to read my list here. Administering inhaled medications, drawing blood gas. So we draw blood from arteries, which is a slightly different skill set than like drawing from veins. So we'll draw blood. We have breathing exercises we teach people and some other therapies to help with secretion clearance. That's where that lung flute thing comes in. We might be performing pulmonary function tests to evaluate for asthma, emphysema, chronic bronchitis, things like that. We spend a lot of time in the intensive care units taking care of people that are on mechanical ventilation. So whenever you hear on the news that somebody's critically ill, that basically means that they're on a ventilator in the ICU, and we work with those patients. And because of that, we're working with the team during CPR and trauma because breathing is usually a challenge at that point. So we're helping. We know how to use the device that helps the patient breathe. We might assist putting if anybody watches the medical TV shows, you can see they get that big metal pry bar out and lift the jaw up and stick a tube in there. We'll either do that by ourselves or assist the physician in doing that. We are involved in educating the patients about how to use their equipment. So if you have COPD, they might give you 3 different kinds of ways to deliver your inhaled medication, and you breathe differently with each one. And poor grandpa is like, I don't know how to do this. So we work with education, and at least when I was at Loyola, I got involved in a lot of research. So that was really fun to, kind of work with the newest, hottest, kind of sexiest thing out there for respiratory, okay? But it was very interesting because a lot of the research that we got involved in identified that, some of the practices that had been cherished from the time they were invented in the 60s, we get into the 90s and we find out that's actually the worst way to take care of somebody. It's like, oops. But we learned, and then eventually we switched. It takes a while in medicine, 20 years, and eventually you beat people on the head long enough and they'll change their practice. So the research was fun, but there's others like I said, you can work your way up into hospital administration. I've worked with people that went into the private sector and eventually became CEO of a medical company. Actually, she's been CEO of several medical companies now. So there are a lot of opportunities out there because it's like I said, in respiratory we work with everybody. So you got to get this very broad overview of healthcare, That help?
Yeah, definitely.
Hello. My question is for Ian. What is your day like? Can you describe how your day is?
Yeah, sure. So when I get there, it's more than just filling prescriptions. I know that's the misconception that all I do is count pills all day, and I don't count by 5s. You could be a pharmacy tech. That's not true. Like I said when I was introducing, you have to know about insurance companies. You have to know a general idea of the medicines. Here's a big thing. You have to know how to interpret what the patient says they want refilled, because they add letters to names and vowels and stuff, so you don't really know what they're saying. But so if they'll say, I need my acid pill, you're not going to put lisinopril, you're going to give them their omeprazole they need. Sorry, guys. Anyway, so I interact with the insurance companies. They have these prior authorizations, like what she was talking about. They prescribe stuff that the insurance doesn't cover. So then we have to call the doctor to talk to the insurance company. This is the worst part about pharmacy.
It's the worst part about medicine.
Yes, medicine. Yeah, I was just saying. Yeah, I didn't mean to put them on blast there. So we have to interact with the insurance companies. We have to interact with the doctors, get refills requests. I have to assist the pharmacist in whatever he needs to do. Compliance is a big issue in pharmacy. There's a lot of laws and regulations we have to follow. Those are very important. You have to be right 100% of the time. There's no error in pharmacy, because if you make an error in pharmacy, bad things happen. But it is a good job. The pharmacy is the first line of patient education. Like if they go to walk-in clinic, they got to pay money, or if they go to the doctors, they have to make an appointment. But they could just come into the pharmacy, ask pretty much anything they need. The pharmacist pretty much has the answer, can look it up. So they could just come and ask a question. If they're sick, pharmacist could recommend a medication.
I was asking because I was thinking about going to the program next semester. But
to tell you the truth,
try to get a job.
Try to get a job. COD does have good programs. I was an EMT and I got my certification, so I did take the class and I learned it.
The new Obamacare thing, what's going to be, if any, the major impact on what you do, pro or con? And just a short, brief answer. I don't want to open up a big can of worms.
I'm great with everyone having insurance. I think it's going to be tons of patients trying to get in where the wait is already very, very, very long, and there aren't going to be enough providers. I'm not saying it's bad that everyone's insured. I think it's great. I just don't know how it's all going to work. I think we'll just have to do it and see.
Yeah, the big challenge is going to be the baby boomers. Within 10 years from now, there's going to be I think between the year 2000 and the year 2020, the number of people over 65 is going to go from 30 million to 75 million. So when the baby boom hump,
So we'll be gone soon. No.
but for whoever's getting into healthcare now, we're going to give you a job for the rest of your life. But I think the big challenge in healthcare in the United States, where we have the most expensive system on the planet, is how are you going to take all of these people who get old and sick and provide care in this system that's not working too well? But at least everybody will have insurance, sort of, maybe.
Yeah.
Ultimately, I don't think it's going, at this point, it's not affecting dental. However, I really think it should, because again, prevention, that's the one aspect. And I think that's the aim. Unfortunately, I think you're right, though, given our society and having the, you'll get rid of us soon, baby boomers. If infants and children and pregnant mothers and all that learn preventive measures early on, ultimately, in the end, I think it will be less expensive. I think that will happen. Unfortunately,
It's generations.
it's absolutely, and it's where do you start?
I think probably it has yet to be, obviously yet to be seen, but, and I think it's great. Again, hopefully most people will have insurance and that will actually play out well. That will be a flood of people actually that come into the healthcare system. But I'm just concerned actually that healthcare is still going to be too expensive for most people. And unfortunately, when they can't pay for insurance, then problems that, need to be addressed get delayed. And by the time they do come in, it's a big problem. We've seen a lot of that during the recession. Even people don't have jobs, they don't have health care, they don't have any money, and then they come in and now they have a big issue and there's no way to take care of it, but we can't turn it away. So then the providers are the ones who kind of have to take that on. The hospitals and practices and doctors would give out a lot of free care, really reduced rate care. And that's fine when it's a small level, but when the whole system gets overwhelmed, it just doesn't work. So hopefully that won't happen.
All right, guys, real quick before we get to the next few questions here, we're going to have to wrap up fairly shortly. So we'll have a couple more questions, and then out of respect for our panelists here, we'll try not to keep them too long. So go ahead.
I guess this is probably for Kelly. I'm curious to know, at one point I'd considered PA school. I think at my age and my stage in life with kids and expense and energy, and I've considered looking at some other fields, one being surgical technology, even though it's a significantly difference in pay. I'm aware of that. I'm potentially in a career change, so I'm looking at some point maybe doing that part-time. But what is your perception or view, or what are your thoughts on being in the operating room? Are you aware of surgical technologists, and
Yes.
are they in demand?
Absolutely. In every operating room, you have an anesthesiologist, you have at least one physician, and then in my case, myself. And then there's always at least one surgical tech. So the surgical techs are the people who open up all the instruments, make sure the environment is sterile, prep the patient, get the patient ready, and then during the surgery, which is sort of their main role during the surgery, they are the person who, just like in the movies, knife, they hand you all of the instruments the whole time, and they make sure all the cords and cables and everything else that's over the patient, around the patient, all their tubes and wires, everything is sort of not tangled. And it actually is a big job. Work with lots of surgical techs of all ages and all backgrounds. They have to be good with their hands. They have to be, a lot of them have to, they anticipate sort of the next move, so they know what's coming. They have to be well-versed in a lot of different kinds of surgery, so they know all the different names, all the bazillions of instruments that there are, and have them ready for who's going to want them, myself or the physician next. It's a lot of time on your feet. And that goes for surgery in general. Anyone who's thinking about surgery in general, you're on your feet all day long. And you will figure out very quickly how not to stand. And when you're holding instruments, holding open a body cavity or something, keep your arms in and not to open them up, or you will have the sore shoulders and the achiest back, and you will invest in good shoes and things like that that you don't maybe think about when you think about doing surgery, but surgical techs are literally on their feet all day long because you don't sit down during most surgeries. You are standing. So, and if it's an hour-long surgery, okay, fine, then you get a break. But if it's a 6-hour-long surgery, you are standing the whole time. If you're lucky, you'll get a bathroom break, if you're really lucky. So something to consider. But
Thanks.
they're in demand.
Thank you.
Thank you very much to all of our panelists. I know I've learned a great deal. I'm sure you all have too. So if we could give them a great round of applause.